Hi, my name is Carrie, and today I'm getting my upper arms lipoed with Dr. Hall.
Today, we are going to do this young lady's arms. We had done a BBL in her waist. She looks great. That was done how long ago?
Over here, yeah.
That really gave her some nice curves. But sometimes after you create the curves down below, you get left with the residual that maybe didn't bother her before, but now the arms kind of make her look bigger and don't match up with the rest of her body. So very difficult area to take the fat pad off through diet and exercise. It's kind of like once you accumulate it here, it stays there. It's the last area of fat to go. At least that's what a lot of my female clients tell me. So taking this off, we can really just give her a much more slender silhouette. It's this fat pad right here that smashes up against this fat pad, what we call the posterior armpit or the posterior axillary fat pad. So we actually clean this whole area off, kind of a C shape right here. And it's just amazing. And it's probably the second most popular procedure that we do here at Infini. So we're going to draw on her. Just going to outline her deltoid a little bit.
It's hard to God.
These little X's that I'm making is just where I'm going to put my different incision points. So one up here, and then one back here. The arms are, cylindrical. They're three-dimensional. So it's impossible to do a really good arm procedure without making multiple little incisions. But as you'll see during the case, our incisions are so small that you can barely see them afterwards. Alrighty, we're ready to go. So we make initial, what we call a bleb with a little bit of anesthetic right there. Then once we get those little blebs, we can just use this little 2 millimeter punch biopsy. It's really small. That's the biggest our incisions are here at our clinic. So we use what's called a true micro liposuction technique. And women love it because they just don't have a lot of residual markings afterwards. At least the most residual that you can get with liposuction, because there are a lot of doctors out there who still use big open incisions that just never heal up and look great. So this gives you your best chance at postoperative success of not seeing where the doctor went in at. So that is it, folks. That's all the bigger the little holes are. The reason why this works and why you can do this while she's totally awake is because 95%, the majority of nerve endings are in the skin itself that we already bypassed by putting some anesthesia. So now we're going to go underneath the skin in the fat compartment. We can just inject this fluid, which contains numbing medication. It's a little uncomfortable, but it's very tolerable. This is called the tumescent process. And this is a very important process. Number one, it allows us to numb the area so that we can do it entirely under local anesthesia. We don't ever have to put the patient to sleep, and once I'm done with this, she's not going to feel hardly anything. But the second thing that it does is it constricts blood vessels, because there's another additive into the bag of fluid that's called epinephrine or adrenaline, and that has a constricting effect on the blood vessels, so it shuts them down. So as we're doing this procedure, you're going to see that there's almost negligible blood loss. There's really no bleeding with this procedure, because we control all that through the injection of medications. Again, if your doctor is experienced and has done this a lot, and it's a big part of what they do, you're not going to feel very much of this. Very important area to get right here. Women hate this fat right behind the armpit. Getting this nice and numb. The same type of anesthesia that a dentist would use. And that's why you don't feel it when they're working on your mouth after they get you injected. Same type of anesthesia that a doctor may use if you have a cut on your arm and they need to sew it up. It's just lidocaine. Should be really nice and numb now. So just slow and steady strokes to really take the fat off nice and evenly. Using, you can see, a very small cannula. Using a small cannula takes longer A lot of doctors don't like it for that region, but this is not a speed game. Lipo is about precision. And so it's our philosophy that we always do what's best for the patient, not what's best for us as surgeons. If you need any more anesthesia, just tell me, okay? So we work a little bit of the fat from that incision, then we come to the other incision. Slow and steady. Just feel mostly a little pressure.
I think
and this is what we call liposculpture rather than liposuction. When we use local anesthesia, we can feel the muscle tone in her arm. She's awake. She's safe and sound without a lot of heavy drugs in her system. And we're using very small instruments to really get a sculpted look. That's the problem with old school liposuction is yeah, you can take the fat off, but how smooth can you keep it? And, doctors that have modernized their practice by using more modern contemporary methods like this really improve their chances of success with each surgery case, of having happy clients. Everybody was afraid of liposuction for many years. It was a horrible procedure. Unfortunately, it's still done that way by a lot of doctors, but it can be done very predictably and very safely. Another term we use for this, the type of liposuction that we use here, that we developed, is gentle liposuction. Because it's the most gentle way that you can possibly do liposuction. You okay? So you can see this arm was done. This arm has not been done yet. So huge difference in thus far you can see already. And we'll sit her up here so you can take a better look. So you can see this is immediately after doing this arm. This arm has not been done, and already the silhouette is just 70% better. Now clearly there's a lot of inflammation, a lot of swelling. All this skin over the next few months will just snap back up. So, the end result will be about like this compared to the other arm. But just huge difference already. All that fat's been cleaned out. How much did we take out? About a half a liter, 500 cc's off this arm alone. So we're going to start on the other arm now. This will take us a little bit of time. Again, slow and steady wins the race in liposuction.
So from the very start of getting the anesthesia part into my body, that was pressure. The most pain I felt was like on a level of 1 to 10, a 2 to 3 at the worst. And he asked me anytime I had any uncomfortableness when he moved to a different little spot, if I needed to have more anesthesia, which was good. And I needed it once more. And level of 1 to 10, that was another 1 at that point because I was already numb. And he just added a little more. And then after that, didn't feel a thing. And basically, I held a conversation with the nurse the whole time and felt no pain at all.
I don't. Well, it can.